FAMPRIDINE is a small molecule drug which affects the excitability of the nervous system. It amplifies electrical signals within nerve fibers and allows conduction through damaged areas. If you imagine an electrical wire with the insulation stripped off over a part of it, FAMPRIDINE acts as a chemical patch that allows conduction of impulses through that stripped area without actually replacing the insulation, so that it's a drug which needs to be taken continuously to allow electrical impulses to conduct. In the normal spinal cord, the nerve fibers carry electrical impulses. Actual electric current flows through tiny extensions of nerve fibers. And those extensions, those fibers, are insulated like an electrical wire with a fatty substance called myelin. And that substance can be lost at sites of injury or in diseases like multiple sclerosis. And when that happens, electrical currents short circuit. And the drug that we are working on, FAMPRIDINE, is a drug which blocks small holes in the membrane that cause electrical current to leak out of the nerve fiber. And by doing that, it can enable nerve fibers to conduct electrical impulses again. Most spinal cord injuries involve not a severing or breaking of the spinal cord, but a bruising of the tissue that leaves some nerve fibers intact across the lesion, but not necessarily working properly. A lot of the research that we do and the therapies that we're developing at Accorda are aimed at maximizing the usefulness of those surviving nerve fibers in people with long-term chronic spinal cord injury.
In 1998, I was at the beach. I dove into the ocean head first, which I must have hit something, and I ended up being completely paralyzed and suffering from a serious spinal cord injury. I was involved in the phase 2 clinical trials of FAMPRIDINE. FAMPRIDINE helped me with a lot of my muscle spasms, which were involuntary control of my muscles. It also helped me with my muscle stiffness, which allowed me to move much more smoothly and not be so tight. It also helped me regain some of my sensation, which I had lost because of the spinal cord injury. I had body spasms in my lower right leg and my right arm. These spasms would wake me up at night. These spasms would make my muscles involuntarily jump. And with taking the FAMPRIDINE, it calmed everything down. It decreased my the involuntary spasms, and it decreased the pain that I had along with the spasms. I kind of live day by day. You can't take any day for granted. You kind of just look at things how they are, and things happen for a reason.
This is an example of a normal spinal cord. There is no impingement or compression along its entire length, from the brain down to the end of the spinal cord. This is an example of a spinal cord injury. There is a fracture of the vertebrae with severe compression of the spinal cord at this level. This is what caused the spinal cord injury in this person. FAMPRIDINE is not going to make the difference between walking and not walking for the majority of patients that take it. However, our research has shown that there's a consistent improvement in many other areas, including decreasing their spasticity, which is the involuntary movements of their arms and legs, improving their bowel and bladder control, and improving their sexual function. These areas of improvement are perhaps even more important than the walking to the spinal cord individual, as it increases their quality of life, their degree of dignity, as well as a degree of independence. One of the most common medical complications of spinal cord injury is spasticity. Spasticity can be manifested in a variety of ways, including muscle stiffness or tightness, involuntary movements of the arms and legs, or even to the degree where the person is thrown out of the wheelchair. It is extremely important to be able to control the spasticity, because spasticity can interfere with the patient's daily life.
There are about 250,000 people in this country with chronic or long-term spinal cord injury. There are about 10,000 new cases every year, adding to that number. Accorda is addressing this growing problem in a number of ways. We have a drug, FAMPRIDINE, that is now in phase 3 clinical trials that has shown the ability to restore neurological function to people with spinal cord injury and also people with multiple sclerosis, by the way. We're working on additional therapies, stem cells, antibodies, proteins, that have the ability to grow nerves back or repair nerves further to give these people even more function. As a practicing physician 15 years ago, I was extremely frustrated that I couldn't treat people with spinal cord injury. I felt compelled to get involved with the research that would develop therapies for these conditions. Today, we're on the threshold of a whole new era, where the therapies that we are developing for spinal cord injury will help not only that condition, but by extension, other conditions that affect the nervous system, like multiple sclerosis, stroke, and brain trauma.
We'll go to your right. Okay?
You're going to position him by the wheelchair. So that's what you're doing. So we're Monday. Just get on. I am like 5 minutes here. All right.
No problem. Good job. Keep working hard.
Did you see Jane hiding anything?
Going to be taking your blood pressure now.
Okay.
You can just relax. Your tone is good today.
You got it straight with.
Thanks, guys. Check me back on Tuesday. Thanks. Hey, Diane.
Hey.
Did you clear everything with Ken for Tuesday?
Yes, you're good at 3 o'clock following the clinical review
Great.
meeting.
Thanks.
Okay, I'll talk to you later.
Accorda Therapeutics. One moment, please. Good morning.
Good morning. An appointment with Dr. Ron Cohen?
Sure, and who shall I say is here?
Dr. Mann.
Welcome.